I will begin by inspecting the skin for the temperature, texture, color, moisture, edema, lesions, bruising, nevi, or scars. I'll inspect the head, looking at the head size, that it is symmetric and that it is midline. I'll be inspecting the hair for the color, the texture, and the distribution of the hair. I will palpate for any tenderness, any masses, any lesions, any indentations or infestations. I'll palpate the temporal arteries, any tenderness. Then I'll palpate the lymph nodes, starting with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then I will assess cranial nerve 5. So I'm going to palpate over the masseter muscle, so clench your jaws for me. Okay, good. Then I'm going to have you close your eyes, tell me where I'm touching you.
Head. G.
Good. Then I'll assess cranial nerve 7, so that'll be facial symmetry, so smile big for me, frown, puff air in your cheeks, pucker your lips, and raise your eyebrows. Good. I will move down to the ears, looking at the shape of the ear and the position of the ear, looking at the internal structures of the ear, but at this time I do not have an otoscope. I would assess the tympanic membrane and all the internal structures. I'll also be palpating on the pinna and the tragus for any masses or tenderness. Then I'll do the whisper test, so just tell me what you hear.
1, 2, 3, 4.
Good. Then I will do the Weber test, assessing for lateralization, so tell me which ear you hear it in.
Both.
Good. Then I'll do the Rhine test and tell me when you no longer hear the vibration in your ear.
Okay. Okay.
All right. Then I'll move down to the eyes, looking at the eyebrows, the eyelashes, the sclera, the conjunctiva, looking at the color for any lesions or drainage, looking at the palpable fissures. I'll assess cranial nerve 2, which would be gross visual acuity, but at this time I do not have a Snellen chart. I'd also assess peripheral and central vision by the confrontation test, so cover your eye on the same side as me. Tell me how many fingers I'm holding up.
2.
And how many?
2.
Good. Then I'll assess cranial nerve 3, which would be direct and consensual pupillary responses to light. I would dim the lights, but for time I'm not going to right now. Just look right here at my nose. Pupils are reactive. And good. Then I will assess convergence and accommodation, so follow my pen light all the way into your nose and all the way out. Good. Then I'll assess cranial nerves 3, 4, and 6 with the 6 cardinal fields of gaze. These would be the extraocular movements of the eyes, so follow my pen light. Good. And with the otoscope or ophthalmoscope, if I would also assess the internal structures of the eye, such as the red reflex. Then I'll move to the nose, looking at the nose, that the nose is symmetric and that it is straight. I would assess nasal patency, so we'll blow out of your nose for me. Okay, can you do that soft too? Good. And then I'll palpate over the maxillary and frontal sinuses for any tenderness. Okay. Then I'll move down to the mouth, looking at the lips, the tongue, the gums, the teeth, the floor of the mouth, under the tongue, the tonsils, the salivary glands, looking at all those internal structures. I will palpate the temporomandibular joint for any subluxation, crepitus, or tenderness. So open and close your mouth for me. Okay, good. Then I'll assess cranial nerves 9 and 10. If you will open your mouth and stick your tongue out and say ah. And the uvula and soft palate rise symmetrically in its midline. Then I'll assess cranial nerve 12. If you'll stick your tongue out and move it side to side for me. Good. The tongue is midline and no fasciculations noted. Then I'm going to move down to the neck. I'm inspecting the neck, looking at the skin, the color, texture, temperature, moisture, any scars, lesions, or nevi. I'll palpate that the trachea is midline, and it is. I'll palpate for the thyroid, so swallow for me. Okay. Then I'm going to palpate the carotid arteries. And then I will listen for any bruise over the carotid arteries with the Bellida stethoscope. Okay. Then I'm going to assess cranial nerve 11, so I'm going to have you shrug your shoulders up against my arms. Good. Then I'll move on to the posterior chest, looking at the chest, the work of breathing at the chest, looking at the skin, the color, the texture, temperature, moisture, any use of accessory muscles. I'll assess for tactile, or palpate for tactile firmness, so say 99. Say 99.
99. 99. 99. 99.
Good. And then I'll also palpate for symmetrical chest expansion, so if you'll just turn a little bit this way. Okay, take a deep breath. And good. And chest wall is symmetric. Then I'm going to percuss all the way down every intercostal space. Okay. Then I'm going to auscultate the lungs in all lung fields all the way down. In all lung fields. Then I will auscultate for egophony, so say E.
E. E. E. E.
And then for bronchophony, so say 99.
99. 99. 99. 99.
And whisper pectorally, so whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Good. Then moving to the anterior chest, I will also be looking at the skin, any work of breathing, any tripoding positions, any retractions, anything of that note. I'll also palpate for tactile firmness and symmetrical chest expansion, so say 99.
99. 99.
Okay, take a deep breath for me. Okay, and chest is symmetric upon inspiration. Then I'm going to listen in all lung sounds. Okay, then moving on to the cardiac assessment, I will be listening at all 4 cardiac points, so aortic, pulmonic, earth point, tricuspid, and mitral. Then I'll listen with the bell of my stethoscope for any bruits, so aortic, pulmonic, earth point, tricuspid, and mitral. Then I'll find the point of maximum impulse, which is at the 5th intercostal midclavicular line, and I will assess the rate and rhythm for a full minute, and the rate and rhythm is 60, and it is regular. Then I'm going to have the patient lie back onto the bed right here for me. At a 30-degree angle, I'll be assessing for jugular venous distension. I'm also inspecting the chest, looking for any heaves or lifts, and I'll palpate for any thrills, and there are none. I will listen again with the diaphragm at all 5 cardiac points, so aortic, pulmonic, earth point, tricuspid, and mitral. I will then listen with the bell of my stethoscope for any bruits, so aortic, pulmonic, earth point, tricuspid, and mitral, and listen for a full minute at the PMI. And for time's sake, it is 60 and it is regular. Then I'm going to move down to the abdomen, inspecting the abdomen, looking at the shape and the contour of the abdomen, any colors or discoloration or anything of that nature. I will listen with the bell of my stethoscope at the aortic arteries, the renal arteries, the iliac arteries, and the femoral arteries for any bruits noted, and there are none. Then I will listen in all 4 quadrants with the diaphragm for bowel sounds. Okay. Then I will percuss for tympany in all 4 quadrants, and then I will palpate all 4 quadrants for any masses or tenderness, and I'll also palpate for the liver and for the spleen. Okay, if you will sit up for me, I will assess CVA tenderness. So if you just tell me if there's any pain with this.
No.
Okay. Moving on to the extremities, so I will inspect and palpate for any tenderness, crepitus, nodules, deformities while the extremities are symmetric. And I'll begin with the hands, so if you hold your hands out like this, good. I'm going to checking capillary refill. Capillary refill is good. Checking the radial pulses bilaterally, and those are 2+. I'll assess grip strength, so squeeze my fingers for me, and they are equal in 5 out of 5. I will inspect and palpate the fingers. Turn it over. My fingers, inspecting that they are symmetric, no nodules, crepitus, tenderness, and that they are symmetric, and that there's no pain with that. I will assess the range of motion of the fingers, so flex your fingers down for me, then extend them, hyperextend them, good. Then abduction and adduction, and then touch your fingers, so all your thumbs, there you go, good. Moving up to the wrist, I'll palpate and inspect the wrist for any tenderness, the color, looking at the skin texture, and the edema and the integrity of the skin as well throughout all of this, palpating for any nodules or pain or tenderness, and then I will assess the range of motion of the wrist, so flex your wrist for me, extend, hyperextend, and then radial deviation inward, and then ulnar deviation, and then a rotation. Good. And then I'll move to the elbows, inspecting the elbows, palpating the elbows for any pain, tenderness, crepitus, nodules, that they are symmetric. Then I'll assess the range of motion of the elbow, so flex for me, extend, and then hyperextend. Good. Then I'll test the strength of the elbows, so pull your arms into you, don't let me pull them down. Good. And then push against me. Good. And strength is 5 out of 5. Moving to the shoulders, looking at the shoulders, palpating the shoulders for any tenderness, any crepitus, any nodules, deformities, that they are symmetric. Then I will assess the range of motion of the shoulders. So if you can flexion, extension, and then hyperextension. There you go. And then circumduction of the shoulder. Good. And then if you will abduct it, move it towards you, and then abduct it, and then hold your arms up like this, and then internal rotation and external rotation. Good. If you'll hold your arms like this, I'll assess for shoulder girth and strength, so don't let me push down, and don't let me push up. Good. Strength is 5 out of 5. You can put your arms down. Then I'll assess for light touch sensation, so close your eye and tell me if I'm touching your left or your right arm.
Left.
Good. Then I'll assess vibratory sensation of the extremities, so close your eyes and tell me where you feel the vibration, if it's in your left or your right wrist.
Left.
Good. Okay. Then I'll assess for sternogenesis, so I'm going to have you close your eyes. I'm going to put something in your hand. Tell me what the object is.
Coin.
Good. Keep your eyes closed. I'm going to assess for graphesthesia now, and tell me what I'm drawing in your hand.
8.
Good. Then I'll move, that's good, you can open your eyes for me now. Then I'll move to the cerebellar coordination. So we're going to do the hand flip flop. If you'll just go back and forth, good. And then touch your finger to my finger and keep going back and forth. Touch my finger, good. Touch my finger, good. And then serial finger opposition, so there we go. Good, and cerebellar function is intact. Then I'll assess the deep tendon reflexes, starting right with the brachioradialis, and move into the brachial, and then hold your arm like this for the tricep. Just let your arm relax for me. There you go. Good. Then the Achilles, or the patellar, I'm sorry. Achilles, and then the Babinski reflex. Good. Then, that is all intact. Then I'll move to the lower extremities. Same thing, looking at the integrity of the skin for any edema, swelling, any redness, any abnormalities there. Looking at the feet and the toes, assessing capillary refill at the toes. I will palpate for the bilateral pedal pulses, and they are 2+, and the bilateral posterior tibial pulses, and those are 2+. I will have check the range of motion of the toes, so flex your toes for me, upward, good, and then, or downward, I'm sorry, and then extend them and then hyperextend them, and then adduction and abduction. Then I'll move down to, or up to the ankles, assessing the ankles, palpating for any tenderness, crepitus, nodules, everything is symmetric. There is no redness or edema or swelling noted. Then I'll assess the range of motion, so if you can put your, push your feet downward, so that will be plantar flexion, and pull them up towards you. Pull your feet up towards you for dorsiflexion, good. And then inversion, so move your feet inward like this. There you go. And then eversion, so out like that, good. And then rotation of the ankles, good. Okay. Pull your feet towards you. Don't let me keep them pull up against my hands. Okay, good. And then push down against me, good. Okay, so strength of the ankles are 5 out of 5. Moving to the knees, looking at the knees, palpating the knees for any pain, tenderness, crepitus. I'm going to assess the strengths of the knees, so push up against my hands, good, and pull down against my hands, good. Moving to the hips and assessing the range of motion of the strength of the hips. Don't let me open your legs, and then don't let me push them together, good. And strength of the hips is 5 out of 5. I will assess light touch sensation, so close your eyes for me. Tell me which lower extremity I'm touching.
Leg.
Left or right?
Left. Right.
Okay. And then I'll assess vibratory sensation of the lower extremities of the ankles. So close your eyes and tell me which ankle you feel the sensation in.
Right.
Good. Then I'm going to have you stand up. Then I'll assess and inspect and palpate the knees for any tenderness, crepitus, any swelling, any nodules. I'll assess the range of motion of the knees at this time, so I'm going to have you flex your knee for me, and then extend it, and hyperextend it, good. And then that's for the hips, okay. Moving to the hips, same thing. Palpate for any tenderness, crepitus, nodules, deformities, swelling, anything like that. I'll assess the range of motion of the hip. So adduct it, and then flex it, and then extend it, and then hyperextend. Sorry, there's not much room. And then, okay, and then internal rotation, and then external rotation. Good. And then circumduction. Good. And that's all intact. Moving down to the spine. If you will turn around for me, and then let's do the range of motion of the spine. I'm sorry. So flex downward for me. At this time, I'm inspecting that the spine is midline and that it is symmetric, and that there's no asymmetry noted, and there's assessing the curvature for scoliosis. So you can stand up for me. So that is extension, and then hyperextend for me. Good. And then rotate left and right. Good. And then bend sideways for lateral flexion on each side. Good. Okay, then you can turn towards me. Good. Now I'm going to assess your gait, so if you'll just walk normally that way for me. Okay, that's good. You can turn around now. I want you to turn around, walk heel to toe for a tandem gait, so there you go. Good. Okay, then we'll assess the Romberg test, so close your eyes and just hold your arms out in front of you. Okay, good. Now I want you to hop on one foot for me. Good. Okay, and that concludes our video.